There are real risks associated to this drug during pregnancy.
Don't you think I know? This wasn't meant to happen. You can't let my dermatologist know.
Hello, and welcome to another episode in the Medical Protection Podcast Case File series. Podcasts based on real cases involving one of our members. I'm your host, Dr. John Marwick, and in today's podcast, we'll be talking about some of the tricky situations involving patient confidentiality. In particular, we'll be touching on issues around sharing information between doctors and what to do if a patient asks you not to disclose something. I'm going to be discussing the case of a GP whose patient got pregnant while she was taking isotretinoin for her acne, prescribed by a dermatologist, but the patient asked the doctor not to tell the specialist that she is pregnant. To discuss this case and the issues that arise, I'm joined by Dr. James Thorpe. James is a medico-legal consultant and senior medical educator with Medical Protection. He's based in the UK where this case occurred, and of course, as is often the case, the legal situation may differ in different jurisdictions. Welcome, James. Really nice to be working with you, and thank you for giving us your time. Now, as I said, I think you're based in Scotland, actually, aren't you? But you work across the NHS, is that right?
That's right, John. And since I joined Medical Protection in 2014, I've provided ethical and legal advice to our members in Scotland, Northern Ireland, and in Ireland predominantly, although I do also speak to our members in England and Wales on our telephone advice line.
Right. And this particular case we're talking about, I believe you did talk about it in one of the webinars that went out to our UK members. And I guess we should acknowledge that the legal situation, particularly around confidentiality, may differ between different jurisdictions.
Absolutely. I think that's a really important point for our members listening from all across the world, John, that the statutory regulations and the regulatory guidance will differ depending where you're working. And if you are faced with a difficult dilemma about whether you should be breaching confidentiality or not, I would always advise you to pick up the telephone and speak to one of our expert advisors.
Absolutely. So I think it might be helpful for our listeners, first of all, to hear the story from the GP's point of view. So let's just play the audio about that now.
I was reading through my emails at the end of the day. There was one from the after-hours service saying that a patient of mine, Anne, was going to go to a clinic for a termination of pregnancy. I thought I remembered, and so I checked her notes. It turned out a few months ago I referred her to a dermatologist and she was prescribed isotretinoin for her severe acne. The dermatologist's letter stated she had said she was not sexually active and there was no chance of her getting pregnant. This meant she hadn't been required to go on the normal pregnancy prevention program. I thought I had a pretty good relationship with Anne, so I gave her a call. It wasn't an easy call. She said the pregnancy was a one-off mistake and she was definitely going ahead with the termination. When we talked about the real risks about isotretinoin and her pregnancy, she became quite emotional. She knew the risks. That's one reason why she wanted an abortion. When I said I should let the dermatologist know, she got quite angry. She said she didn't think I should have been told, and she said very clearly that she didn't want the dermatologist to know either. I told her how important it was that she discuss the risks of the drug with her dermatologist, especially given her pregnancy. I also offered her to talk further in my practice. She is going ahead with the termination, but I'm still unsure whether I should let her dermatologist know or should I just respect her wish for secrecy. If I was her dermatologist, I guess I'd expect her GP to tell me.
tricky situation for a GP. I guess as a GP myself, I normally think that I should know about my patients, and I guess I would normally feel that I would let these specialists know in this situation too. So it's tricky, isn't it? That would be normal practice, I think, for many doctors.
Absolutely, John. I think it certainly is a tricky situation. Certainly, this is a UK case, as we've already alluded to, and in the UK, the regulator for doctors, the General Medical Council, in their confidentiality guidance, they state that most patients understand and expect that relevant information must be shared within the direct care team to provide their care. And they say that you should share relevant information with those who provide or support direct care to a patient, unless the patient has objected. And I suppose that's the important point here, that we have a clear indication that the patient has specifically objected to the GP sharing that information with the dermatologist. So certainly something to be to consider very carefully.
I hear she actually told the doctor that she didn't think he should have been told about it by the emergency department. What do you think? I mean, is that something that would be normal practice? Again, I mean, in the UK and in many countries, people have a regular doctor, and I guess the regular doctor would expect to be told about something like this. But
in most circumstances, that information would be shared. And I think unless a patient specifically objects, or there's a reason to think that the patient may object to that information being shared, certainly fairly standard. There's that element of implied consent for information sharing within the clinical team, but there are certain situations, particularly very sensitive situations, where you would want specific patient consent.
And I suppose actually this sort of thing, having an abortion or going to get an abortion. Similarly, I think some of the sexual health clinics and so on, these would be the sorts of situations where patients might sometimes say, I don't want anybody to be told.
Well, absolutely. And services are set up differently around the world. But certainly, for example, in the UK, some of the sexual health clinics are separate to the hospital or separate to the GP practice, because some patients want to keep that aspect of their care confidential. So these can be really tricky issues, and the sort of things that we get telephone calls about on our telephone advice line.
So if a patient does say, I don't want you to tell that, I mean, should we, therefore, is that enough? Should we just basically say, okay, this patient has requested privacy, and I better not share it? Is that the best thing?
I think, John, it's a really interesting point. And I suppose our starting point is thinking about patient autonomy and the importance of confidentiality. And obviously the risk is that if patients don't think their information can be kept secure by their doctor, they may not seek medical attention with potential impacts on their health or potentially the health of others. So really, it's a balancing act, and any consideration of breaching confidentiality, you really have to think of the potential consequences of that for the patient, but also for others. And there are circumstances where it may be necessary to consider breaching patient confidentiality in the public interest. So I suppose the starting point is that if you have a competent patient and they specifically ask you not to tell another doctor about a certain treatment or certain procedure, the starting point would be that you should, certainly in the UK, you should usually respect their autonomy in that decision. Mm-hmm. But if there is a potential public interest in disclosing that information, if there is a risk of the General Medical Council in the UK talk about serious harm to others, if there's a risk of that, then you would need to consider whether it's necessary to breach that confidentiality. And it gets more complicated in that sometimes there is a legal duty to breach confidentiality in certain circumstances. And again, those laws will differ depending on where in the world you are working.
Right. Also, James, you mentioned legal requirements. I guess there may be in different countries at certain times certain laws that say doctors have to inform the authorities.
That's right, John. And many countries will have a requirement for doctors, for example, to report certain communicable diseases to the appropriate authorities. Or, for example, in the UK, there may be a requirement to report issues, for example, under the Terrorism Act. So there are potentially legal requirements to provide information. And again, in the UK, if you're ordered to provide information to the court, for example, you may have to release information. So there are a myriad of different circumstances when it comes to confidentiality, and certainly that's why always good to contact us if you need that specific advice.
Perhaps we can pick up on each of those in turn. Before we do, I was interested when I watched your webinar, James. I think you put a question to the audience, didn't you? You actually did a little poll. And I think the majority of people felt that in this situation, they should respect the patient's wish for confidentiality. But if I remember rightly, there were 20%. You had three options, and something like 60% agreed with the respecting confidentiality. But there was a significant number of your audience who felt that they maybe could break the confidentiality in this case. So it's not clear cut. This is a tricky, difficult question for doctors, and that's why I think it's a useful one to discuss.
Absolutely, and I think with all of these situations, they are never straightforward, and that's why we would always advise that if you find yourself in a real life situation, that you speak to our advisors for specific advice, because sometimes there are very small nuances, and even if the case, for example, was similar to this one, there may be slight differences, and it's always worth picking up the telephone and getting that tailored advice.
Do you get questions about confidentiality reasonably frequently?
I would say on a daily basis on our telephone advice line, John. I think it's one of the most common things that we're asked about. Doctors are often asked for information, for example, from solicitors, from other agencies. They might have a patient who has a health condition, which means that they shouldn't be driving, but the doctor knows that they are continuing to drive. So there are lots of issues that our members come to us with respect to confidentiality.
I can just think there that the driving one, you mentioned one of the situations where maybe it would be appropriate to break confidence would be if there was a public in the public interest. Do you want to expand a little bit on that?
Absolutely, and it's not necessarily just driving, but if for example you had a patient who was an airline pilot and they had disclosed to you that they were suffering from new onset of seizures, but they didn't want to tell the authorities or the regulators for pilots, then you would have to consider whether it was necessary to protect that there's potentially a risk of serious harm to passengers in that type of scenario. And that's the type of scenario where you'd have to consider breaching patient confidentiality. And different jurisdictions, again, will have different guidance, but certainly in the UK, if there is a risk of serious harm to others, you would have to in that type of situation, I think it would be difficult for the doctor to justify not disclosing that information to the relevant authorities in the event of a subsequent tragedy. So that's a pretty extreme example, but more commonly it's when somebody continues to drive, and clearly somebody who's been diagnosed with having seizures or or epilepsy, usually they have to tell the authorities, and that usually their license is taken away for a period of time. But if they're refusing to tell the authorities, they're continuing to drive and they're putting other road users at risk. Certainly in the UK, the regulator's guidance is that you should inform the driving licensing authorities in those circumstances.
Is there anything else we should be concerned about? So in what I'm hearing you saying, James, is in general, the patient who requests confidentiality, if they're competent, you would respect that request in most situations. But there may be these public interest or risks to others which can occasionally override it. But basically, you're also saying, I think these are complex issues, and it's just exactly the sort of time when you should be picking up the phone.
Absolutely. And I'm conscious we've got members from all over the world listening to the podcast. And for example, the regulations surrounding reporting health issues and those driving will differ slightly depending where you are. I think in general, the principles are likely to be similar, but certainly I would recommend that you seek specific advice.
James, thank you very much. I think it's interesting, isn't it? A simple case, a case like this, which might on the surface appear quite narrow, can very quickly become quite broad. And your advice has been fascinating, really, really helpful, and particularly that issue about getting some advice about the particular details of the case in the local jurisdiction.
Thank you, John. It's been a pleasure speaking with you.
So interesting to hear the experience of a medico-legal consultant and how often questions about confidentiality arise, and of course the real value of making contact to get advice about the local legal situation. Members of Medical Protection can get such advice by ringing our local advice line, and you'll find the numbers in the podcast description. And with that, we reach the end of today's episode, Can I Really Say Nothing? If you're new to these podcasts, maybe listening for the first time, make sure you subscribe to the channel to make listening easier in the future. You can access this podcast from all the major applications, including Apple and Google and Spotify. For more information about medical protection, or if you're already a member and would like a certificate for listening, please look for details in the episode description. And with that, I've been your host, Dr. John Marwick.